Hi, everyone. Welcome back to this week's episode of The Conversation with me, Jordan Brown. This week, we'll be discussing public health with Michelle C. Burrows. She's the founder and CEO of MC²Consulting LLC and is committed to advocating for women's health equity and specializes in female empowerment and leadership. Michelle is currently the Director of Community Engagement for the University of California, Riverside School of Medicine, the Center for Healthy Communities. She leads the Center for Healthy Communities in promoting community-engaged research. The mission of the CHC is focused on remedying social injustices and health disparities that contribute to poor health of individuals and California's Inland Empire and beyond. Michelle has a depth of experience as a public health practitioner in direct patient care, community engagement strategies, state and county public health program administration, implementation, and evaluation. Michelle brings a public health career of over 25 years and is a master connector, collaborating with diverse organizations to solve complex problems facing communities, cities, and school districts with the private, public, and nonprofit sectors. Michelle has earned her master's in public health from Loma Linda University and a Bachelor of Science from Howard University. Let's welcome her onto the show. Hello, Miss Michelle. How are you doing today?
Good. How are you?
I'm doing well. I'm glad to have you.
Yes. Good to see you.
Yeah, so I guess let's go ahead and get started. Tell us a little bit about who you are and how did you get invested into looking into this public health centered side of the health field?
Yeah, so I'm Michelle Burrows. I started in public health actually when I was working back east in DC at Children's National Medical Center. And I engaged with a lot of, individuals of color that didn't have access to healthcare, and the healthcare they were getting at local clinics was not quality care. And I just realized that there were so many just disparities, in us accessing and getting good health care. And so it made me think, well, why is that? What's the reason? And I basically came up with this idea that, from the people that I talked to in the community that were coming into our clinic, is that it was all around health literacy. A lot of our individuals, our community members, they didn't understand, they didn't understand their rights. They didn't understand the things that they could do to get access to quality health care. And they just really didn't feel like they had a voice. So I, am passionate about service. And so that's what kind of got me into the field of public health, because I'm passionate about health and I'm passionate about serving my community. So I wanted to, make sure that that narrative didn't stay the same, that we were able to be literate in health and be able to, access appropriate health care.
Yeah, I think that's awesome. And it's a really powerful work, especially in the times that we're living in. I just completed a little, my work over the past quarter with UC Riverside was teaching a cultural class dealing with health in medical anthropology. And so we taught this kind of culture, health, and healing centered space. And we're really able to provide some sort of literacy for the students to be able to talk about different issues of health, and not only like how we have like biological health problems, but how where we are socially can affect our health as well. And, different situations, different intersections of where we come from can also affect our health on so many different levels. And it's really important to pay attention to that so we can understand, how do we heal our communities, going through certain things, even looking at different spaces, depending on where people live. I've heard over the past few months that people that live near meat processing plants have higher risk to cancer. And so it's like thinking about how can we literally move from the situations that we're in right now? How do we take our communities and make sure that we have healthy air quality? How do we make sure that we know how to take care of our physical bodies? How do we know how to gain a perspective of total health and working with mental health and spiritual health and and physical health altogether. So I guess my question to you is, what is this idea of total and like a holistic look of health? What does that look like for you?
Oh, wow. So you're talking about basically mind, body, and spirit. And I have launched on Black Voice News, a new show called Black Facts, and it's P.H.A.C.T.S. It's public health, awareness, culture, testimonials, and science. And I'm hoping to be able to talk to, our community about holistic health, and make sure that we understand the importance. All of it is intertwined. We have to be mentally healthy. We have to make sure that we take care of our mental health. We don't want to talk about that because oftentimes we're told, oh, that's crazy talk. Like, there's nothing wrong with you. You're just sad or whatever. But we really need to talk about our mental health. We've gone through so many things. There's so many historical traumas. There's so many current traumas, that we're experiencing in our lives. And so we have to address our mental well-being, and then we have to address our physical well-being. How are we caring for ourselves? Are we eating the right things? Are we getting physical activity? That's a component of our health. And then spiritual, our spiritual health. How are we able to take care of ourselves so that we can be calm, relax, be able to deal with all of the stress and the assaults that come at us, on a daily basis. So I'm really using this platform to be able to share, different ways that we can, like I said, take care of our total health.
Yeah, absolutely. I think it's a beautiful thing, and I'm so glad that your show is really going to be able to call that and speak that out loud so that people
Yes.
are able to understand, how do we put these things together, and what does that look like in a practical level? Because I know that so many people are even just afraid to start taking care of themselves in whatever capacity, because we always associate like physical health with losing weight. And it
Right.
might just be, hey, I need to work on my physical health so I can be a fit person. I'm not aiming for something other than to make sure my body is moving, to make sure that I'm stretched, to make
Mhm.
sure that my blood is flowing and that I'm continuing to keep up with the physical being. And it's like we have to recognize that we can have these goals, we can go for weight loss, we can go for a body transformation, but also we have to take care of ourselves on just the basic level of like eating and drinking water and making sure that we are up to speed with how we are and with how we exist. And I know that you do this work with UCR as well. Can you talk about the Center for Health Disparities?
Sure. So we have the Center for Health Disparities Research, and we also have the Center for Healthy Communities, which I'm the director over. And that center, primarily, our goal is to engage the community on community-based participatory research. And what that basically means is it's not your grandfather's research where research was done on communities. It really is research in partnership with communities to really kind of identify what the health priorities are or the health issues are that are important to the community. And then kind of backtrack and say, okay, well, why aren't you accessing services? Are there barriers? Are there language barriers? Are there cultural barriers why you're not, going in to access a certain particular service? And where you are not, feeling comfortable about addressing this particular issue. So we really, like I said, work in partnership with the community and identify, and allow them to lead our design and our methodologies as to how we go about creating programs and interventions that are going to ultimately help the community, improve their health outcomes.
Yeah. Can you talk about some research projects that you've worked on?
Yeah, so recently we are working on a Stop COVID in the Black community. And actually, it's a three-part. It's an NIH grant that we received, and from the Health Disparities Research Center. And what it is, it's the Native American community, the Latino community, as well as the Black community. And I'm the lead for the Black community. And we're talking to them about their behaviors, ideas, attitudes as it relates to COVID testing, and the vaccination. And, basically just trying to understand what are their fears, what are their apprehensions around getting tested. We don't really want to kind of delve into the vaccination part. We are asking questions through focus groups and different surveys, but we really want to understand what are people's understanding of COVID, the virus itself. How are they working in their communities to not continue to spread the virus? And then also, what are their fears or apprehensions around getting tested? What does that look like? What are the attitudes and beliefs in the community around, that? So it's been very interesting. We had a focus group this morning and such a rich dialogue. There were so many amazing community members that showed up and participated and really just lent their voice. And they were on polar opposites. It wasn't like it was a kind of a kumbaya, moment. We had community members that were like, I will not get tested because they have certain beliefs about testing and vaccination, and others that were like, I'm all in, like I want to do my part, right, to be able to ensure that this virus, I do my part to stop the spread of this virus. So that's one of the projects that we're working on, and we're working on, like I said, a bunch of other ones. We have another one that we're doing in partnership with our engineering college of engineering, and it's around air quality. And we're working with JW North High School and just kind of teaching and helping the kids understand, the impacts of air quality on their health. We found that a large majority of the student body population has asthma. And, it was kind of very interesting. It was like, okay, why is that? Well, we found this particular community, they're very close to the 60 and 215 interchange freeway. There's a lot of industry around the school and the surrounding community. So that means there's large diesel trucks that are coming in and out, emitting, particles into the, environment. And we already don't have, great air quality as it is, but they particularly are impacted negatively as a result of their location. So yeah, those are a few of the projects that we're working on.
Wow, that is incredible work. I love to see how you take these kind of potentially lofty ideas and then put them into real practical life and making change and making an impact directly on communities right here, which I think that's incredible. So I know we talked a little bit about how you got into or how you started working within medicine, but can you recall a time maybe when you were, I don't know, before you even got into the field, like what really sparked this passion in you that said, this is the work that I need to do?
Well, I have a brother who's disabled. He has muscular dystrophy, but he has a rare form of muscular dystrophy. He wasn't diagnosed until he hit puberty. And that was like a very pivotal time in our family's lives. He's my older brother. And so, I had to go with them to the hospital for him to get tested because we couldn't really figure out what was going on. And so I would say that was a pivotal moment for me because, I have my older brother who's kind of coming in and telling my parents, I just don't feel right. And, I feel like something's going on. And we really didn't know what was going on until, we went to the hospital, and it was, test after test after test before they finally came back with this, this diagnosis that he had this onset of muscular dystrophy as a result of puberty. And it's a pretty rare form, and it only happens in males. And so that, kind of had me start really thinking about health. And to my mom and my parents, of course, they started researching and trying to figure out herbals, or different herbs and different things that he could take other than these steroids that they were, kind of pushing upon my family for, to give to him. And just with my mom seeing how dedicated and committed she was, like, no, we're not going to go the drug route where I'm going to pump my child full of all of these, these steroids. I'm going to find a natural way to be able to, help make sure that he maintains his health as long as possible. And, they said that he wasn't going to make it to 18 and, then 20 or whatever. And, now I'm proud to say he's 52, and it has nothing to do with me, but that was something that shaped me because I saw my mom's commitment and her, how she kind of changed what she fed us, how we did things around the house. And so that kind of really instilled in me the importance of, if you don't have your health, you just don't have anything. And, I just developed from there and always knew that I was going to be in the health field somewhere. I didn't know exactly what I was going to do, but I definitely knew I was going to be doing something around health.
Thank you for sharing your story.
Mhm.
It really goes to show just how deep this conversation in health goes, and how
Yes.
we need to continue having these conversations, because your work will continue to save lives.
Yes, absolutely.
If our work
Absolutely.
is not impacting the community in a positive way, if it's not changing lives, if it's not changing minds and hearts and spirits, like, what are we doing the work for? So I'm really blessed to be here to talk to you about all of this.
Mm,
Wow.
thank you.
Yeah. So I don't know. Um, let's see. We've talked about so much. I'm wondering what else our audience would be interested in. Um, I don't really want to talk about the challenges of 2020, and I know that that's something that I ask often and try to go in this space. But I really want to say, I really want to know, how has 2021 been good to you?
Well, it's been good because I finally am able to, like I said, launch Black Facts, and that has been, something personal that I've been thinking about, didn't really know in what context I'd be able to share the information. I am a public health practitioner. That's what I do in my work life, right? But I'm very passionate about health in my personal life, and the health of my family and friends. And I just kept thinking, what could I do on an individual level to make an impact? And so this opportunity has presented itself, and I'm very, very excited because I feel like finally we're going to be able to have rich conversations and authentic conversations, where we're going to talk about anything and everything as it relates to health. They're going to, there's going to be some shockers, I think, that people are going to experience in watching the show, because I'm going to be really real and ask some really um, I shouldn't say challenging questions, but ask some real questions that I talk about amongst my friends, or I know some of, we kind of talk back and quietly, but we don't ever kind of let people know these are the things that we're concerned about as it relates to our health. And I want to talk about mental health. I really want to talk frankly and candidly about our mental health as, the Black community, and how, yes, we are resilient, we are amazing, we are powerful, but there's a lot of trauma. There's a lot of trauma that we've endured. And how do we preserve our mental health? And what are we doing to ensure that we're mentally healthy moving forward? Because once again, if you're not mentally healthy, you can't be physically healthy. You just can't, because you're going to be doing things that are going to sabotage your physical health if you're not mentally healthy. So that's one major, like, amazing thing that's happened in 2021 for me.
That's beautiful. I'm glad that you talk about mental health in that way, and are going to be able to talk about it in a frank way, because working in the academy with UC Riverside specifically, it's very difficult to speak about mental health, especially in my case, in being a graduate student. It's very shunned upon, even though it's something that everyone is
Right.
dealing with. It's something that
Absolutely.
everyone is dealing with, because there is so much pressure in this field. There's so much competition. There's so much aggression, honestly. And I just wish that the culture of everything would open up to allow this conversation, because this conversation is integral to succeeding and to
Yes.
not only surviving life but thriving in it. Because you don't want to go through life just having to, you know, survive on the I don't know, on just low energy. We really want to see how we can do things dynamically and do things by being engaged. And it's hard to do that when you're dealing with different mental struggles. So I think having those conversations is really gonna open up the floor and open up the space to make it more normal to have these conversations within
Absolutely.
this profession.
Destigmatize it.
Yeah,
There's, like you said, everyone has their challenges at some point in their life. And if you haven't already, you're going to, you're going to have some type of issue where you're like, wow, I need to just sit down for a moment. So I want to destigmatize, mental health, depression, anxiety. I want to destigmatize all of that. We need to start having frank conversations, and we need to be there for one another and support each other, instead of, kind of casting people aside, saying, oh, well, okay, something's wrong with her, so we're just gonna, kind of act like we don't see it, we don't hear, but really address it, really address it and help people find ways to cope and move forward, positive ways to cope, not, self-medicating ways, but positive ways for them to cope, and be able to move forward in life.
Okay, so with that, can you just give, I guess, one maybe positive way to cope, maybe a word of hope and inspiration before we go?
I say that we have to, my first show, it was about self-care. We really have to get to the point where we feel like we're worthy enough, we're worthy enough to stop and take care of ourselves, because if we cannot take care of ourselves, we can't take care of others. Like that saying goes, put your own oxygen mask on before you can, save the life of somebody's by putting theirs on. Make sure that we, really are taking care of ourselves. It's not being selfish. It's not, it's not being any of that. It's really about loving yourself and knowing that you're worth it, and stopping and figuring out, what does it look like for my optimum health? What does that look like for me? And taking baby steps. Start with something. If it's just, like, I love to dance, well, start dancing. And before you know it, if you're having, weight issues, the weight will start to melt off because you're doing something you love and you're being consistent with it. So just find little things that you can do to, like I said, to take a moment for yourself and to, celebrate, that you woke up this morning, you have life, and, think about what you can do to help others too, to move forward and spread some love and joy in this world.
Awesome. Thank you so much, Michelle. That was so beautiful. I enjoyed having you here.
Thank you for having me. I really appreciate it.
Thank you so much to our special guest, MC². Burrows, for joining us today. I hope you all enjoyed the show here with me at home. Remember to stay safe and mask up as always. And I want you to encourage everyone to show support for the great work that we're doing, and so that we can continue to bring out more great content, because what we do it for you. And we're all in this together, so we can't do it without your support. For more information on how to give, please visit our website at blackvoicenews.com or click one of the links in the description box below. It's the act that matters, not the amount, so donate today. And as always, don't forget to like, comment, and subscribe. See you real soon. Peace out.